A turbuhaler is a medication delivery system used by adults and children 6 years of age and older. The system is inhalation-driven, meaning that medication is delivered to the lungs through the force of breathing in. Unlike aerosol inhalers, the medication is dry powder and no propellants are required to deliver it. Administering medication using a turbuhaler is comprised of 3 simple steps. Step 1. Unscrew and remove the cover. Step 2. Hold the turbuhaler in one hand and twist the colored bottom of the turbuhaler with the other hand. Twist the grip in one direction and then the other until a click is heard. Hold the device with the mouthpiece pointing up. To prevent medication loss after hearing the click, avoid turning the turbuhaler upside down, shaking it, dropping it, or breathing into the turbuhaler. If the medication is lost, Step 2 must be repeated. Step 3. Begin by sitting or standing up straight and exhaling, taking care not to blow into the device. Place the mouthpiece between the teeth and wrap the lips around the mouthpiece tightly so that no air can escape. Tilt the head back slightly and then breathe in as quickly and deeply as possible. Remove the turbuhaler from the mouth and hold your breath while counting to 10 slowly or as long as possible, and then exhale. If a second dose is required, repeat steps 1 through 3. When finished, replace the turbuhaler cover and twist until it's tightly closed. After taking the medication, it's important to rinse with water, gargle, and spit out. Inhaled steroids left in the mouth may upset the normal balance and allow yeast to grow. Turbuhalers have 2 different forms of dosage counters. One keeps track of doses in units of 20, while the other uses a side dial. A red mark first appears in the window when there are 20 doses left. The device is empty when the red mark fills the window. It's important to keep track of doses, since even an empty turbuhaler will make noise when shaken, creating the impression that medication remains. Turbuhalers, like all dry powder inhalers, require a desiccant or silicone gel to draw moisture away from the medication. As a result, a turbuhaler can feel partially full even when empty. When administering the medication, it's important to take a strong, deep breath. Only a strong breath will generate the energy required to spin the device's turbines and release the medication. Because the device is breath actuated, there's no need to wait between puffs. A second dose can be taken immediately after counting to 10 and reloading, as opposed to MDIs, which require up to 1 minute to repressurize the propellant. Another factor affecting the efficacy of the turbuhaler is the seal on the mouthpiece, which should be as tight as possible to maximize the force of the inhalation. For children using a turbuhaler, proper administration techniques should be consistently reinforced. They should be reminded often that turning the device upside down, shaking it, or dropping it will cause the medication to be lost. Blowing into it will dampen the dry medication, and this should be avoided. Children should also receive ongoing coaching about the importance of inhaling strongly and deeply, a tight mouth seal, and counting slowly to 10 before releasing their breath. Older children should be encouraged to keep track of the doses used and mark down in a calendar the date they will require a new device. Because the turbuhaler is a device that administers dry medication, it should never be immersed in water. And it should only be cleaned with a dry tissue. Saliva on the mouthpiece will also affect the device's operation and should be removed with a tissue after each use. And finally, if the hole becomes clogged with medication, it should be removed with a brush.